One of the most common cosmetic procedures doctors perform has the reputation of having a very painful and difficult recovery. But new technology is changing the way some surgeons perform rhinoplasty, more commonly referred to as a nose job. Julia Rasuli is much happier with her looks these days. She underwent rhinoplasty to fix both a deviated septum and to cosmetically reduce her nose. She says she didn't experience the trauma that's often associated with the procedure, from the pain to black eyes.
It was nothing like I had imagined before. It was completely the opposite. I had no pain.
Rhinoplasty has a reputation of being a brutal procedure, and not entirely undeserved.
Dr. R.Laurence Berkowitz is a plastic surgeon in Los Gatos. During a break in a rhinoplasty procedure, he showed us some of the tools still in use for traditional versions of the procedure, which involve breaking bones in the nose in order to reshape it.
You're looking at instruments that have barely changed in about 100 years. Mallets and chisels were used to break the bones. These saws were used to saw the bone before you would break it.
But he says recent advancements in technology have radically reduced the trauma.
What's new is the development of ultra-high-frequency power tools that assist us in shaping the nose, moving the bones without breaking the bones.
The new generation tools include saws so delicate they can cut through bone without disturbing the surrounding tissue.
I can actually thin or shape cartilage, something you could never do.
He says the techniques have significantly reduced side effects, including black eyes, while other advances have cut healing time. One of the more recent involves taking blood from the patient's own body and using it to create a kind of organic glue.
Using the patient's own blood to make fibrin glue allows us to seal the wound as an internal adhesive, and it reduces bruising tremendously.
For Julia, the combination of new techniques allowed her to return to medical school courses in under a week. The result was also a combination benefit: easier breathing from her corrected septum and the emotional boost from the cosmetic side of the procedure.
It improved my confidence, and it just my nose became a better fit for my face, and I was very happy with the outcome.
Now, when it comes to insurance coverage, if the procedure is done to correct a breathing problem or deviated septum, it is usually covered by insurance. If it is done purely for cosmetic reasons, Dan, as you can imagine, it is not.
Not covered in that case. All right.